Hello and welcome to a special podcast. This is your host, James Maskell, and I am here with Dr. Jeffrey Glad. Welcome, Doc. How are you doing?
I'm doing great, man. It's good to hang out with you again.
So this is a special series of podcasts. Last year, I did a complete interpretation of my genetic profile, and people seem to like it. I think not many people had ever seen a empowering genetic consultation happening live. And so in that realm, I wanted to take a moment today to really just talk about lab testing in medical practice, because this is an area where I think that different people are doing a lot of different things in the functional and integrated medicine space. For those of you not familiar with Dr. Glad, he and I met 6 years ago as faculty of the Heal Thy Practice conference that we were together for 4 years. And if you heard the announcement last week, he is now the Chief Medical Officer of our new project, New Health. And, one of the reasons why I decided to work with Jeff on this project was actually because of the way that he practices and the model that he's created. Now, if you've read my book, that Jeff is one of the sort of heroes of that book because he's been able to deliver root cause resolution medicine, integrated medicine, functional medicine in Fort Wayne, Indiana, to a much wider group of the population than most practices that we see. Part of that strategy has been about creating a structure where you're really making it easy for patients to interact with the labs and the supplements and that part of the practice. So Jeff, maybe as a starting point, you could just share a little bit with the audience sort of what your learning process was and how you ended up coming up with the lab model that you currently have in your practice.
Yeah, for sure. So as I got started, now going back 10 years when I was with the hospital, it always started with a big lab panel. So lots of data and two different focuses from what happens traditionally. Number one, a variety of different markers, deeper markers, more information, but also the reference range and the interpretation was vastly different. So just being in the normal ranges isn't a health strategy. So as I started doing that and using labs, realized the power that information had for people to impact, their health and want to make changes and just sort of want to come back and review the labs. And so, for all kinds of reasons, it's great for them. It's great for your practice. It keeps them accountable, but it also keeps them coming back into your office. So a couple years in, I started catching wind of patients canceling appointments because the labs were too expensive. And it was just as these, the deductibles just started creeping up and sometimes sort of shockingly so, patients were getting this giant sticker shock of labs. And so they weren't going to pay $2,000 or $3,000 to get labs done. I don't blame them. So out of that became a necessity of, is there a better way to figure this out? And we had a patient who's actually a midwife tell us about a lab company that was doing LabCorp labs at cash rates and it was incredibly less expensive. So we immediately just implemented that policy and just, went out and reached out to all our patients. We now have cash labs. The discount's incredible, come connect with us. And so even to this day, matter of fact, my staff was just telling me yesterday, we had a patient who said, turn down the cash labs. No, my insurance does a good job of covering LabCorp. I'm just going to go there. Calls 15 minutes later and says, no, you guys are hundreds of dollars cheaper. Let me just do the cash labs. So we've been able to continue, and now we work directly with LabCorp on our own account. But $3,000 to $6,000 is the panels that we've seen when people take a chance and use their insurance and get hammered by by an out-of-pocket cost. We do those same lab tests for anywhere from $200 to $400. And so we're seeing more patients come in more regularly and be more engaged in their labs. I mean, we have some people do markers every month because it only costs them $10 or $15 as opposed to a couple $100 every time they do it. So, we've just enjoyed it from, mostly from the patient care perspective. Obviously, as a practice, you can now say, listen, your giant lab panel and the extensive interpretation that you're not going to get anywhere else is going to be less expensive than just doing the labs or just showing up at an urgent care and having a 7-minute office appointment.
Yeah, absolutely. And it was back at the March Functional Forum where you shared that, in the evolution of cardiology, that this is on that functional forum. That was the moment that I realized, okay, this has to be the model, because the numbers are shockingly different. I mean, if just the combination of giving your insurance card over in an environment where you have a high deductible plan, it's almost like when you give the insurance card, you're kind of saying you have permission to charge me full price. Right?
Yeah, no, without a doubt. You also, and another thing that attracts some patients, not all, but when you hand that insurance card over, you're essentially making that data public. Labs have it, hospitals have it, people can acquire that information, and so if you want truly private medicine, you pay cash, and it doesn't go through those channels, and it lives just between LabCorp and the patient, and they've obviously invited me into that relationship, but I don't share that with any other entity. So the insurance game, and it's very, it changes things quite a bit. Again, it's great for the catastrophic thing, but when you're just trying to optimize your health and do it in the best way possible, it doesn't make sense to pay that much money for something that's exact same data, dramatically less expensive. Because again, you'll do it more often, you'll do it more regularly.
Yep.
You'll let it inspire you to make the changes necessary.
Absolutely. Yeah, no, I think this is something that everyone in the space needs to really understand, because I know a lot of people are doing, different types of labs, and if we can make it ultimately as cheap as possible, like, this era of medicine that we're in right now, where single payer is not coming anytime soon, right? Under Trump, we're only moving towards more self-payment, more health savings account, more people being responsible. So we have to teach our patients to be responsible with their healthcare dollars. And that's, I guess, just one more thing I wanted to talk about, the role that you've played in your practice as sort of like a fiduciary almost for the patient, to be able to say, hey, this is the practicalities of how the system works. I understand how the system works. Let me just take a few minutes to help you understand how it is, because I really feel like ultimately what you're doing there is developing trust with the patient, because you're helping them to understand something that's no one else is helping them to understand.
Yeah, for sure. And finances is one of the, it's at the top of the list of stresses for people, right? So if you can help in that department, you're also aiding, their stress management. So all the time, I mean, we continue to gather the information necessary to help people save money. So if you need a colonoscopy, we're sending you 2 hours south because it's only $1,000 cash, and to teach them the difference between, yes, your insurance pays for a screening colonoscopy, but the minute they do a biopsy, it's now a diagnostic colonoscopy. It's not screening. Your insurance doesn't cover that. Now it's a $6,000 bill. You go to somebody who's operating in a cash market, it's $1,000 either way because he's doing the same procedure. So it's those kinds of things that it's unfortunate that no one is a champion for the patient from this fiduciary perspective, which is obviously what our mission is at New. It's what my mission is here in the office. And it's a necessary mission, is just how do you save money for the exact same stuff instead of getting buried in all kinds of bills that you really shouldn't have anyway.
Absolutely. So let's just talk about like what labs you run, because ultimately in the functional integrated space, one of the sort of like selling points of these kind of practices is, well, we offer labs that no one else offers, and, that kind of thing. But ultimately, you've been building your practice in Fort Wayne for a very wide kind of population, people who are chronically ill, who, need help of your kind of care to get better. So what's been your take on, traditional labs, different interpretations of traditional labs, and then sort of like the more functional labs?
Yeah, no. So I usually only start with basic blood work. And a lot of it is going to be the stuff we're going to talk about that you had done. I usually go a little bit deeper than that in terms of some of the blood markers, and we can kind of talk about some of those that we don't get, but because we believe this core panel now that we're doing gives us that information. But to me, this is the best assessment to just understand what the lay of the land is. I always describe it to patients as, let's just figure out what's going on at the State of the Union internally. So there's some nutrient markers that help us in that understanding. There's certainly the classic lipid panel that we're going to look at very, very differently, and also blood sugar and inflammation. So it gives us a nice overview of what's happening inside. That basic set of blood gives us then other things that we may want to investigate, either down the road or right away. You're going to see as we walk through this, there's so much information that can be gleaned from this, way more than the medical assistant calling you and leaving a message on your answering machine saying your labs were fine. Like that doesn't exist, and that just can't cut it anymore. You've got to understand, even if the markers are great, someone should understand why they're great. What's great about them? Just because they're in the normal range absolutely doesn't make them great. And so it's this explanation and this understanding, and people finally start to get it. And then now they're engaged. Well, how can I change that? Well, hey, last time you said this was going to go down. It didn't. What might be going on? So to me, the expensive deep labs are important and still necessary, but not as necessary for all comers. So I just could never get to the point where I charged somebody $5,000 and did gigantic workups, most of which just is unnecessary, because if you have a few key markers, you can kind of figure out the story. It still goes back to, in medical school on day one, it's all about history. Like if you just take a good history, you'll figure out most of it. And that's still absolutely true. And the lab data then doesn't necessarily give you the answer as much as it supports your feelings of what's going on, but also gives you this great opportunity to inspire the patient to become engaged and get more and more involved with what's going on.
Yeah, absolutely. It rings to me of this idea of the therapeutic order that we've spoken a lot about before, where you start with the least costly, least invasive interventions first, right? So you might start with diet and exercise and lifestyle, and then you might move up to supplements if necessary. And then only at the end, if nothing else works, would you consider drugs or surgery, right? I think that's an idea that time's come. And in the same way, look at this for lab testing. It's right. Do an extensive history. It's basically just the physician's time. Doesn't cost anything. Do the very basic blood markers and get them at the cheapest possible cost for the patient. Then if and only if you're not making progress towards the patient goals with just that, then you can start to look at a wider panel of those markers. Then you can start to look at the functional tests. And I totally agree with you, because what is the value of a test if it doesn't increase action on behalf of the patient, and if you don't test again? And I know for a fact that in most practices around the country, because I sit in the Facebook groups and I can see what people are saying. Oh, the people didn't come back for the labs. What shall I do? They're only getting it once. They're canceling their appointments and doing it. But if you're not having this kind of conversation with them, how would you expect them not to do that? Like if they're not intelligent as to understand, how the system works and how to save money, they see you as part of the scam, because part of this is a scam, right? Paying 20 times over the base cost for a lab panel. Like in some of these things I've seen, it's like $5 versus $100, right? That is, in any other country, that would be called a scam. In this country, maybe they call it capitalism or whatever, but that seems like a scam. Now, if you're sort of inadvertently being seen as being part of that system, that is the quickest way to lose trust. And I think the biggest opportunity for functional integrated medicine at this exact moment is the development of trust as quickly as possible, and therefore being able to separate yourself from the rest of the system and say, hey, I've worked out the system and I'm going to communicate to you how to navigate it, and I'm going to help you navigate it. Wow, people can relax. People can say, wow, this guy's got my back. And, I think in the same way that sort of Tony Robbins outed a few years ago the fact that you're like, your financial advisor, if they're not getting paid by you, might secretly be getting paid by the mutual fund whose thing you're selling. In the same way, doctors are sort of in that position. And I love the positioning of like, hey, I'm on your side.
Yeah, without a doubt. And I think it also kind of gets into that, I'm starting to get really uncomfortable when I go to these conferences, right? And the exhibit halls are lots of tests and lots of supplements. And again, I'll be the first to tell you, these specialty tests are super valuable in plenty of cases. And the supplements are incredibly valuable for getting people back on track. But we can't miss the main point, which is the functional medicine lifestyle. That's the key that has to happen for there to be any sustained health benefit. And so are your labs cultivating an improvement in the functional medicine lifestyle and inspiration toward the lifestyle? Or are they giving you longer and longer lists of supplements? And so it goes back to all those things, but it really is relationship. And the patient, you have to understand where they're coming from, and they have to understand where you're coming from. That's why we have this money talk all the time. Hey, what's your budget for this look like? Well, I only have a couple $100. Then let's just do $50 worth of testing, because I'd rather have you spend $150 on really good food and working on some stress management stuff. What happens is, even we're getting cost blind in the functional medicine space too, where, it's a $500 test every time they come in. Well, of course they're going to make less and less appointments because they see that as a big payment every time they have to show up.
Absolutely, yeah. And this is a sort of an inadvertent commercial for New Health here, because ultimately what we're doing at New Health is helping patients implement the functional medicine lifestyle and to navigate the health system. Functional medicine doctors and practitioners, we need you guys to be able to do the deep diagnosis, to be able to work with the chronically ill. But ultimately what we've seen and what I've seen in practices across the country, and what you've told me too, Jeff, is that if you get this part right, a lot of other things go away. And if you get this part wrong, you can't make sustainable changes. And so this is why we're diving deep into a new paradigm of healthcare, which is the new evolved primary care network is implementing the functional medicine lifestyle, helping people to navigate the system as it is right now. So if you want to find out more about it, newhealth.com. If you want to talk about getting your patients onto it for people that need this kind of help and you're not delivering it in your practice, let's have a conversation. We'll do it. But I want to get into now the blood panel themselves that you've chosen for new. And I know that we're going to develop this over time as the prices come down and down. But why don't you just share with our audience now, what are the things that you chose to put into an initial panel, bearing in mind we wanted to keep the cost below $200 for the initial panel so that people would retake, several times a year?
Yeah, no, for sure. And there's lots of hurdles just in the cash environment too. I mean, the labs are a little bit spooked by telemedicine. The labs are a little bit spooked by patients ordering their own labs. So we're still trying to navigate all that. I think as it comes to bear, we'll be able to do a more extensive panel at a lower cost. But we chose the high level things that are going to get us the best value and the best conversations. So that would be your standard fasting lipid panel, which is your cholesterol markers. And as we walk through that, it isn't just looking at an LDL and deciding whether you need a statin or not. That's not why we measure that marker. We're going to measure inflammation, which is the high sensitivity C-reactive protein, which to me is just a great overall marker, not just of risk of heart attack and stroke, but sort of status of the immune system and where things are. We take a look at ferritin. Ferritin is a storage of iron, but it also has an inflammatory component. And so usually people that are inflamed have a higher ferritin level. It doesn't necessarily mean iron, it means inflammation. Low levels can also be issues of absorption, digestive health. And we know that low ferritin contributes to a decreased thyroid hormone sensitivity. And I actually think this is the game that we've got to do a better job of figuring out, is not your thyroid levels. Like we're all great in the functional medicine space at taking thyroid levels and giving a dose that gets you normal. But what we don't often realize, and certainly the patient doesn't realize, is if their body doesn't respond to a normal level of thyroid hormone, they're always going to have an issue. And so we know now that that's stress, and ferritin is one of those markers, other vitamin and minerals. It gets back to the lifestyle. If your lifestyle is poor, then your thyroid hormone sensitivity is probably not great either. We measure a fasting insulin, which is sort of the pre-diabetes measurement to help people understand kind of where they stand. Even though their fasting glucose and their job health fare was normal, they still may be walking right into type 2 diabetes and have no idea about it. Then we look at thyroid markers as a thyroid screen, sort of the overall TSH marker, and then the active thyroid T3. So we chose those two to give us the best window into what's going on with the thyroid. We do a B12 level and a vitamin D level, nutrients related to mood, related to absorption from the B12 perspective. Vitamin D, we all know what impact that has. So really important to look at that. And then we look at that average blood sugar, the hemoglobin A1c, which I think is really just the greatest insight into where we're heading with risk. And so now I've got, pulled from the research, sort of the charts of, as soon as your A1C gets above 6, your risk of heart attack skyrockets, your risk of stroke skyrockets, risk of cancer goes straight up too. That's eye-opening for patients to say, that this number, again, it may be a really positive thing for them. You know what? You think you eat too many carbs, your A1C is really, really good. Let's focus on some other things, or maybe some of the other effects of sugar that might be negative for you. So again, those are the markers that we've boiled down to look at. Eventually, we'd like to grow this and look at, sort of the ANA, the anti-nuclear antibody, a couple other nutrient markers. But to me, this is 85% of the core of what's really going to give us the best information.
Yeah, so one of those markers, I'm glad you shared that out. And just on a practice management tip for everyone who's listening there, when a new patient comes into we talk in the language that we've been talking to you for 2 years. So, Jeff is not explaining all of these markers to every patient. Jeff's made a series of videos that explains each one of these markers so that you can go through and understand what's a good range, what's a normal range, what's an optimal range. And that is just an automated system that people who start to take the labs get. And I just want to talk to, everyone here who's building their own practice. We've been talking about this in the Practice Accelerator and our trainings for years. So as we go about building new health, we're showcasing the strategies that we've seen. And those videos are really well put together, professional, and anyone who's watching them can get a good understanding of how to interpret their labs. Now, we're going to do a tour. We announced the tour a couple days ago. We're going to do a tour later this year where we're going to go city to city and inspire the functional medicine movement and the group there. A few months ago when we start talking about doing these kind of events, Jeff, you thought that the hemoglobin A1c marker was like one marker that we could do, for a couple of reasons. One, because of exactly what you just shared there, that it's the number one marker for sort of chronic disease risk, but also, that we could do a lot of tests very quickly. You can do sort of commercial testing very quickly. What is it about if someone had never interacted in a sort of a preventive way with their health and an integrative way and a functional way with their health, how important do you see that marker in being able to change behavior and sort of wake up, especially dudes like me, to an idea that, that there is something that they need to be getting on with now because they're, if we're going to talk about predictive medicine, right, this is a pretty strong predictive marker.
No, for sure. And type 2 diabetes is rampant and climbing. The risks keep going up and up. Again, I think as we keep looking at this more and more, heart attack risk, stroke risk, cancer risk, very heavily tied to excess blood sugar. And that's a threefold issue for people as you think about the functional medicine lifestyle. One, it's sugar and carbohydrate intake, which is, continues to go up, particularly in kids, but really in all of us. It's a lack of quality exercise, the kind of exercise where you challenge the muscles, because it's the muscles that, will increase your insulin sensitivity and put glucose away. And it's stress. It's the three pillars of any lifestyle talk, all tie to your blood sugar levels. So that in and of itself is huge. So it's risk in terms of connecting those dots. But then think about that hemoglobin A1c marker. What are you measuring? So first of all, the way I explain this is, why do we even care about diabetes? I mean, the only reason we care about diabetes is because sugar corrodes tissues, right? We don't care about diabetes as a name. We care about the complications of diabetes: heart attack, kidney issues, nerve issues, where you lose your vision and you have amputation. All that happens because sugar corrodes tissues. what a great window into that problem by looking at an A1c, which is basically sugar deposition on your blood cells. You can see how much corrosion or prevention of corrosion is going on right away. And you can do a finger stick, which is what we're going to do in the tour, and lots and lots of people can do this. It's not perfect. There are gaps, but at least it's going to highlight people to understand they may need to really focus on that. If their A1c is awesome, let's go focus on some other things to get optimal and prevent that from happening. So it's really sort of that really key marker that we look at a lot. Right now I'm wearing a continuous glucose monitor. That's a sticker on the back of my arm. I'm tracking my glucose all day long, 24 hours a day now. It's just fascinating information. And it's been really empowering for me to figure out what my breakfast routine is and how I can do better to kind of keep those numbers down. So to me, knowing that blood sugar number, the A1c is just the start. If we can now hand out continuous blood sugar monitors because they're pretty convenient at this point, we got to get the cost down some. But this is just truly empowering information. Eventually, they're already talking about putting on the Apple Watch. Now you just don't even have to put a needle in. You just wear the watch and be able to monitor things there.
Yeah, super exciting. Yeah, well, thanks for sharing that. And I'm really excited to, let's deliver hemoglobin A1c readings to, tens of thousands of hundreds of thousands more people. I think it's a really inspiring moment. The way you just shared it is perfect. So this is the moment where I'm, if our goal as a doctor, as I said earlier, is to build trust with the patient as quickly as possible, my goal with New Health and what I've been doing all this time is to build trust with you, the practitioner, and everyone who's listening to this. And so I've decided, again, in classic Maskell style, is to just have Jeff do an interpretation of my blood labs right now so you can see what this actually looked like. What does it look like to get a functional interpretation of a typical lab count? So, I have seen these results. When I did my other one before, when I did my genetics, I'd never seen it and I wasn't know what I was getting into. So I have seen these numbers, so I know kind of what's going on. But, we can pull them up on the screen and let's just get into it. And for the people who are listening, Jeff, maybe you could just shout out the numbers so you know what's going on.
Yeah, no, for sure. So again, we'll start with that lipid panel. And you look at the numbers for those who can't see the screen. The total cholesterol was 190, goals to be less than 200. The good cholesterol number is your HDL. That was 56. It seems that it's protective when it's above 59. So just a touch shy of that. Triglycerides at 110. And the reference range is to be less than 150. But ideally, we'd really like to see that under 100. And then your LDL, which is the number everybody sort of points to, it's flagged as high. So now, everybody's worried about taking a statin, or you would be, in the conventional setting. So if we just take those numbers and talk about them a bit, the way I break this down is I'm looking at, more importantly, I'm looking at the triglycerides and the HDL. Because the triglycerides tell me, from a carbohydrate perspective, how are we doing? Are we over consuming them? Are we handling them okay? There's a liver component to that. So most people think of triglycerides as fat, and it is fat, but it comes as excess sugar that the liver has to convert into fat. So yours at 110 says we probably want to tweak down our carbohydrate intake some, particularly in the fructose food department. That's sugar, that's fruit juice, that's dried fruits. Those would be your high level things. We may, and we're going to talk a lot about omega-3 fatty acids here in a moment, but you may increase your omega-3 fatty acid intake to also help drive that triglyceride marker down. To me, it's important to do that because as you look at that LDL cholesterol, and again, as we talked about, that LDL being a little bit higher than we want it to be at 112, to me, that's not a concern. Stress elevates this. Doing this more regularly is probably better to understand whether we're at a familial genetic risk of making too much cholesterol. But 112 is fine. It's even better if we can see the triglycerides come down lower, because the triglycerides dictate the size of your LDL. lower triglycerides, larger LDL, less concern about plaque and heart disease risk. So to me, your numbers here with an LDL of 112, a triglyceride of 110, and an HDL, I put you in the good category. Usually talk about great being optimal, good being not at high risk, could be better, and then you sort of got the warning and high concern level. So I would say overall, this is good. Again, a small tweak toward lowering refined carbohydrate in your diet, increasing healthy fats, particularly the omega-3 fats, which not only will help lower your triglycerides, but also increase the HDL because the healthy fats will do that. Exercise, again, challenging those muscles, basically accelerates this whole process, increases the HDL, brings down the triglycerides. So from a standard lipid panel, again, looking at this very, very differently than your conventional doctor is doing, where they're going to look at total and LDL, and the MA is going to call you and say your cholesterol's high. Go on a low-fat diet.
Yeah, so just so I'm clear, so one of the cool things is I'm going to do this again in like 3 or 4 months before we start the tour, and everyone's going to see the changes there. So that's pretty cool. I guess I just wanted to ask you, if I'm in a situation now where I'm just at my primary care doctor and I've taken those labs, first of all, I've paid way too much for the labs because I got the high deductible plan. But now, am I being put on a statin with those numbers?
Probably not. I mean, I really hope not. With your age, I think even today, most doctors are not going to go there at the levels you're at. You're at maybe 150, 160, which to me is still lifestyle convertible. Maybe then the recommendation is there. I highly doubt most practitioners would be going that step at this point. They've gotten a little bit more in tune with saying, hey, you know what, give this a chance lifestyle-wise. Let's see it again. Certainly if it's rising, I think the recommendation comes in. I don't think we're going there yet. Although if you look at the next marker, it might actually justify that a bit. So, you look at this high sensitivity C-reactive protein number. This is inflammation. So this is inflammation of the lining of your blood vessels, and it speaks to then your risk of heart attack and stroke. And as you see in the chart, less than 1 is ideal. That's low relative risk of heart attack and stroke. 1 to 3 is average risk. So again, I say less than 1 is great, less than 3 is good, and above 3 is a high risk. And so you're at 3.8. So that's certainly the most concerning thing in this lab panel. If we're calling this a very, very important marker for predicting risk, it's high. And so this would be your main focus, would be how does James lower inflammation? And that's an assessment that a coach or nutritionist needs to walk through. Where are the inflammatory foods for you? That would be the omega-6 foods. Are there any fried foods? Where's the processed and refined? Are you getting enough omega-3 fatty acids in your diet? Wild caught fish, salmon, halibut, nuts and seeds and flax have some, not nearly as potent as fish. And then going probably almost certainly adding fish oil as a supplement to your regimen to really help drive down the inflammation. So to me, this is your number one priority, is driving down inflammation. And again, all ties into the lifestyle. So talked about the nutrition piece of this. This is probably where the statin shines, is statins have an impact on lowering inflammation. I still don't think anybody's taking you there, even in the conventional world. But that would, potentially justify it if someone had a very high cardiovascular risk, a history of heart attack, and had this high inflammation level. But for you, it's really, you're just, really need to tune in, your focus toward inflammation and driving it down.
So if you saw better exercise, better stress management, more fatty, the fish oils and so forth, what would you expect that to come down into the good range or even the optimal range?
Yeah, for sure. I mean, even within 2 or 3 months, you could see this drive down into the optimal range. Another thing it really kind of highlights for some people is the whole concept of gluten sensitivity. Gluten's a very inflaming food, can have a direct impact on irritating that immune system. And that's despite celiac disease. But you tend to also see people who cut grains out of their diet, at least early on, aggressively, also get an advantage to driving this down. And then once you get this down, if that lifestyle is too restrictive for you, play around with a little bit, find a little balance, maybe a 90-10, 80-20 balance. And as long as we can continue to see that CRP stay under 1, then you're maximally keeping inflammation down. Again, that's part of that whole balance story of, I'm trying to move away from long-term restriction because it just, if it doesn't have to happen, let's not have it happen. Let people kind of enjoy some of, the delicacies of life, as long as it doesn't negatively impact their health. So that would be a marker that you're going to follow kind of long-term, seeing how changes in your lifestyle, changes in stress levels, changes in sleep, how that impacts that inflammation marker. Because starting at square one, you're on fire, so to speak.
That's great. All right. Well, look, definitely work to do there. Let's get into the rest of the panel and look what else we've got here.
Sure. So I'll bring this up here real quick. We've got that ferritin marker that we talked about, which is that storage of iron, and also an inflammatory number. So I like somewhere between 50 and 150 as the sweet spot. You're at 189. Again, I don't think that's a bad thing. I don't think that's it might be a slight inflammation thing. I suspect if your C-reactive protein comes down into the 1 range, I bet ferritin comes down as well, but it's certainly not a high risk marker for you at this time.
Cool.
Next would be that fasting insulin level. And again, this is sort of the pre-diabetes level. So as we talk about, someone's blood sugar may be perfectly normal. And as we're talking about blood sugar, let's just skip down to kind of look at that. Your hemoglobin A1c is really quite optimal. Less than 5.4, I think is fantastic. Lower is always better. You're at 5.2. That's really, really good. So what that tells us is that you don't have an elevated sugar issue. So then you look back and say, okay, well, I realize I don't have, type 2 diabetes or persistently that elevated blood sugar. Am I set up for that? And that's where the insulin comes in. So you look at a fasting insulin in the morning, and I would say good is less than 10, great is less than 4, particularly in a fasted specimen. You're at 6.2. Again, really good, not great, could use improvement. I think anything you do to impact those triglyceride levels that we talked about early on, tweaking down your carbohydrates, focusing on the omega-3 intake, I think you see that insulin level come down even lower and be in that optimal range. But I certainly would not call you pre-diabetic, as we call it, people who have normal blood sugar but are starting to see a little bit of insulin resistance. Not seeing it there. Next would be kind of a little bit of an insight into what your thyroid is doing. And so we look at TSH. TSH is thyroid stimulating hormone. This is a hormone from your brain to tell your thyroid how much hormone to make. So a low level is really what we're aiming for. That would be your brain happy with your thyroid levels. The lab reference range, really, this is probably the most contentious part of functional medicine. The lab says 4.5 and under is good. Most functional practitioners would want to drive that below 2. You're at 2.1. So it's a little bit above where we want to be. I don't think nearly high enough to justify being aggressive. And if we look at your active thyroid hormone, the T3, you're well in the middle of normal at 3.1. So from a thyroid perspective, I'd say good, not great. And again, some of the nutrients involved in thyroid production may be helpful. Is that a little bit of L-tyrosine, a little bit of iodine, a little bit of zinc and selenium? You can get those from foods. So a health coach and nutritionist would kind of walk you through what are the anti-inflammatory whole foods that help lower inflammation, help bring down the triglycerides, up with the HDL, and support your thyroid, right? So that's it. What's the lifestyle for you that's really very, good for everyone, but kind of pointing out and highlighting the foods most important for your unique panel. Again, I wouldn't really even aggressively do much here. Thyroid does relate to metabolism. So being able to kind of burn off inflammation and kind of, hum along would be helpful, but I don't think it's in need of any type of hormone supplementation. So, a pretty good range from that perspective. Next would be vitamin D. And if we look at that number, obviously this is an important one, but also very personal because it's based on the season and your sun exposure, and likely has some genetic components in terms of how well you convert sun exposure into vitamin D. And so most of us at this point feel the optimal zone is 40 to 60. So you're at 31. It's January. You do get some sun exposure in your location and where you're at, but maybe you need a little bit of vitamin D supplementation and or sensible sun exposure would be the key for getting your vitamin D up into that 45-50 window. Vitamin D is an anti-inflammatory. You need that help. Why not drive the vitamin D up higher? Again, some sensible sun without getting sunburn or supplementing a little bit of D3 would be the key. It'd be a nice one to track, particularly through the winter, and then probably able to ease off of the supplementation. Most of the time you see somebody who's in the 30s in the winter, they probably have no need for vitamin D supplementation in the summer months. It's just come down a little bit outside of the optimal based on the season.
Yeah, that seems reasonable. I would also say I do spend a lot of time inside and trying to spend more time outside. Obviously it makes sense to me that, if we go back to the concept of, the therapeutic order, if you can improve it through being outside more and taking more, time in that way, it's a good way. I feel sorry for all the people right now in Indiana where you are, and New York, because as we're recording this, it's like -10 everywhere. But I live in Los Angeles, so I will do better on that one for sure.
Yeah. And we've already looked at that last marker that I had on the list here was the hemoglobin A1c at 5.2, which was really good. So again, we're going away from this saying, gosh, this is pretty darn good for not knowing what this information was and having no clue. I mean, you've heard of all these markers, but you didn't know what your personal numbers were. The inflammation one is, should be inspiring for you to implement change, because that one is in the high risk zone and you don't want to be there. So, as we talked about, kind of now the focus goes to the nutrition information, to the health coach to really kind of figure out, okay, what are James's goals? What are James's habits? How are we going to bring those into focus under that lens or through that lens of the inflammation so that we can drive this down? Now that number is a great one for you to be following and monitoring and sort of lining up with, this is the status of where my health is kind of based on this CRP number.
Absolutely. Well, look, Doc, I really appreciate you taking me through this. This has been a new experience, for me. Obviously, I've been in this space for 12 years and certainly heard a lot of this done together. But as someone who was 24 and now 37, hasn't been and generally healthy, hasn't been something that I think about. But at the same time, I do realize, if we realize that, I have a history of Alzheimer's in the family, right? And that's connected to inflammation. And I probably need to start thinking about that now, or maybe even a few years ago, in order to start to think, am I going to be one of the X percentage of people that's getting that when by the time I'm 80? And so that's something to start thinking about now. And also, I'm very interested in what does it take to get men, particularly men, to to start to take action on this earlier in life. And so I hope that this has been informative for those of you listening. If you're a patient, to get a really good idea of how to save money on your labs, and also how to do a different type of interpretation on standard lab panels. If you're a doctor or practitioner, understanding why it's important to be able to create trust by cutting out the middlemen and being a fiduciary for your patients, I think is a really important shift in the business model. And
it is. Hey, James, I forgot. I'm going to stop your momentum here, but I forgot one marker because I realized it was squeezed in between thyroid. I didn't want you to wrap up and have us miss it. That was the B12 level. So vitamin B12, part of the story in the same way. I mean, it's part of optimal function. It's part of energy. It's part of brain function. This huge range of normal is really pretty classic of vitamin and mineral levels in the conventional lab report. So 200 to 1100 is a crazy wide range, but you have to realize that the reference range is really determining malnutrition and true deficiency versus being okay. And so we don't just want to be okay. I'm always shooting for being above 700. I usually say 700 to 1,000. So you're at 434. that does highlight a potential need for you to kind of support that level. Now, that might be supplementation after chatting with, somebody kind of dive into your lifestyle and dive into nutrition, increasing your B12 foods. Another really interesting way that this connects to lifestyle is the ability to digest and process your meals. And that gets back to sort of the habits of how we eat. And I've had a few meals with you, James. I know you go fast. And so taking your time and eating, letting the acid increase, letting the enzymes increase will be valuable for you for increasing your nutrient intake. That'll be showing up in the vitamin B12 level, but it also shows up in those thyroid levels, because the thyroid, the ideal function and sensitivity relies on the nutrient level. So I didn't want to skip that one. And if anyone was kind of paying attention would have noticed that. But that also would be something to be working on and keeping an eye on.
Well, if you're interested in seeing what it looks like to have a consultation with a health coach who can really dive deep and get into some of these numbers and make recommendations, you're in luck. Because in February, we will be doing that with Tracy Harrison, who's the director of coaching for New Health. And so, stay tuned for that. We're going to be sharing that with everyone. But yeah, between the different supplementation and the lifestyle, I really appreciate the time here. I'm also, I've never wanted to be the guy in any way saying like, hey, this is how I am healthy, follow me, I'll show you how to do push-ups or whatever. But because, this is something that I do want to do, I am going to be sharing on this journey and then into the tour, just my insights on what it's like to be just a normal guy trying to make lifestyle change on Instagram and Instagram stories. So if you use Instagram, you can check me out. I'm Mr. James Maskell, and follow me on Instagram stories. And I'm going to be talking about, once this podcast comes out, I'm committing to, over the next few months, really sharing my journey with you. And I hope that, if anything else, it's inspiring for other men. But also that, as a patient, as a practitioner, if you're watching this, that, that the health is happening in 167 hours a week where they're not in your office. And I think, what we've spoken about a lot in the evolution of medicine for the last 4 years is how do we actually facilitate the transformation for patients? And I think data has a lot to do with it. And I'm really excited to be going through this process. One, so that everyone else can see what this looks like. Hopefully this builds trust in our organization and what Jeff and I and Tracy and the rest of the new team are trying to do here. We're really excited to be also working with some insurance companies and some employers in delivering this, because ultimately the majority of Americans are getting their healthcare via insurance, via employers, even with what we spoke about earlier. And so we're excited to be sort of offering that and looking for new ways to expand out functional medicine to a much wider population. But I hope this video is useful. I really appreciate your time. If you want to find out more about New Health, you can go to newhealth.com. It's New Health with a K. And Jeff, thanks so much for being with us. And I know that we're going to be eating together soon, and you'll be able to see how slow I'm going.
That's right. Oh man, it's good to hang out. Yeah, for sure. Happy to help.
Great. Well, this has been a special session for Evolution of Medicine and for New Health. This has been, I'm your host, James Maskell, being with Dr. Jeffrey Glad. Thanks so much for watching, and we'll see you next time.